More than 10,000 people die of cancer in Kentucky each year, with lung cancer taking the most lives. And the Commonwealth has one of the highest rates of new lung cancer cases in the country. MedCenter Health has created a lung nodule program to help address the rates. WBKO's Lauren McCauley spoke with hospital personnel to see what they're doing to combat the disease.
Smoking is probably the #1 contributor to lung cancer.
The Lung Nodule Program is a joint venture between MedCenter Health and Western Kentucky Heart and Lung. It was developed as a way to identify lung cancer at the earliest stages to either prevent serious issues before they occur or treat concerns as quickly as possible.
If they come into our lung nodule clinic on Friday, we're going to try to get a biopsy if they need it by the next week and try to get that pathology report as soon as possible to see what kind of treatment they need, if any.
On Fridays, a team of several doctors and specialists meet to view and discuss patients that may need further examination and help plan their next steps in care.
Anybody that has chest imaging, whether it be a screening or any other type of imaging, where a nodule is found, that image or that report comes to us, and as a team we look at that and decide, do we need to bring this patient in? Do we need additional imaging? What can we do for that patient?
One of the reasons they're able to diagnose quickly is due to a new piece of robotic technology called the ion bronchoscopy.
It directs the surgeon through a computer-aided system directly to that nodule, and it allows him to get much smaller lesions where historically they had to be over a centimeter. Now he can go smaller than that.
Director of Clinical Integration Jennifer Finch adds that the program is important because not only is there a high rate of lung cancer found in Kentucky, but all over the U.S.
We want people to get screenings. Low-dose CT screenings are very important, especially if you have a history of smoking. We want you to get that screening. We want to catch your lung cancer at stage 1 when it's curable, potentially curable. There's a 70 to an 80% survivability rate at stage 1.
And many of those who are specialists within the program, like Dr. Karen Nelson, also have personal ties.
Personally, I had an aunt that started smoking at age 8, and unfortunately at age 38 she was diagnosed with advanced stage lung cancer, and she ultimately died from it. So it's very personal to many of us.
In Bowling Green, Lauren McCauley, WBKO News.